Hello everyone. Now I will discuss about nephrotic syndrome. Now, in nephrotic syndrome, there is massive proteinuria, more than 3.5 gram per day protein loss. Okay, and because of that, there is hypoalbuminemia. Okay, and along with that, you have peripheral edema. So there was question in your NEET entrance exam that peripheral edema in nephrotic syndrome is because of. So the option were sodium and water retention, or it is because of hypoalbuminemia. Hypoalbuminemia. Okay, so which is mainly responsible? Okay, both things are happening. If both are there in options, okay, then it's very difficult to answer this question. But if the option comes like both sodium water retention and hypoalbuminemia, both are responsible, then it is the best answer. But if you get separate options, then go for hypoalbuminemia, okay, because sodium and water retention related edema, it is when the condition is very, very severe, okay. So generally, just take hypoalbuminemia. So this is the most accepted answer for this question. Okay. Now, apart from this, we have hyperlipidemia as well. In children's, it is more. Okay. Hyperlipidemia. Now, in hyperlipidemia, the question comes that what is the lipid profile? Okay. Now, here you have raised serum cholesterol, down good cholesterol, HDL, which we say is a good cholesterol. Okay. Then it is LDL, which is creating controversies. Some book writes that LDL amount are still normal, okay, and some book says it is raised. So you can write it is normal or raised, but never down. Okay, so that is important. In severe cases, you have raised triglycerides also. Even VLDL are also raised in case of severe condition. Okay, so these two are raised in severe conditions. Okay, whereas high cholesterol is no doubt is there. LDL is again controversial, but it is either normal or raised. Okay, so remember all these lipid changes. Repeatedly asked question from this topic. Okay, now next, what is there? Next in nephrotic syndrome is hypercoagulable state. Hypercoagulable state. Why? What's the reason for this? It is because of loss of certain natural anticoagulants. Due to loss of natural anticoagulants, which are nothing but proteins. Okay, so the most important is antithrombin 3. Okay, so because of the loss of antithrombin 3 with protein, okay, it is also a protein, so it is also lost. There is hypercoagulable state. Other proteins are protein C and protein S. Now, next is anemia. Which type of anemia is there? It is microcytic hypochromic anemia. Microcytic hypochromic anemia. It is because of loss of transferrin. Due to loss of transferrin. Okay, so transferrin loss in urine. So there is iron deficiency anemia or microcytic hypochromic anemia. Next is hypocalcemia. Hypocalcemia. It is secondary to the loss of cholecalciferol binding protein, due to loss of cholecalciferol binding protein. Okay, so there is vitamin D deficiency in the patient. So there is secondary hypocalcemia. Okay, so the parathyroid hormone levels, okay, so they are also affected. So PTH is raised. Increase PTH. Okay, now next is hypothyroidism. Hypothyroidism. Basically, all the important proteins are lost in nephrotic syndrome from the body. Okay, so which protein is associated with thyroid? It is thyroid binding globulin. Thyroid binding globulin, which is required for thyroid hormone synthesis. Okay, so thyroid binding globulin is also lost in urine, and because of that, there is hypothyroidism. Okay, now one important findings in male, that is known as Muircase lines in nails. Okay, so it is due to hypoalbuminemia. Okay, so this Muircase lines in the nails is also a characteristic finding of nephrotic syndrome. Okay, now what are the complications? So we have discussed that there is anemia, there is hypercoagulable state, there is hypothyroidism. Okay, so what are the complications that can leads to life threatening conditions? Okay, so you can have deep vein thrombosis or renal vein thrombi or peritonitis. Now, this peritonitis is considered as leading cause of death in case of nephrotic syndrome. Okay, now, and it is mainly because of pneumococcal peritonitis. Okay, so you can write it is the most common cause of death in case of nephrotic syndrome patients. Okay, now next I'll be talking about the genetic causes. Okay, so certain genes and you can say protein mutations are there which are causing nephrotic syndrome in patients. Okay, so let's discuss all of these. First one is NPHS1 gene. Okay, so first is NPHS1 gene. Okay, so in case of NPHS1 gene mutation, what happens? Nephrin is mutated. Okay, so there is mutation in nephrin. Okay, so it is present in chromosome number 19. So it results in congenital nephrotic finish type syndrome. Congenital nephrotic finish type. Finish type because it was discovered in Finland. Okay, finish type disorder. So in the exam, they will ask question. Okay, this one NPHS1 is associated with which type of nephrotic syndrome? So it is congenital nephrotic finish type. Okay, so that you need to remember. Now NPHS2 is the second. NPHS2 present on chromosome number 1. Here podocin is mutated. Okay, and it results in idiopathic steroid resistant nephrotic syndrome. Idiopathic steroid resistant nephrotic syndrome. So these two are very, very important and frequently asked. Now, just remember the name of third and fourth one. Third is alpha actinin 4. Alpha actinin 4. And fourth one is TRPC6. Okay, so this TRPC6 it causes adult onset nephrotic syndrome. Okay, nephrotic syndrome, and it is FSGS type. FSGS, focal segmental glomerulosclerosis type. Okay, now alpha actinin 4, it is causing autosomal dominant variety of FSGS. Okay, autosomal dominant variety of FSGS, focal segmental glomerulosclerosis. Okay, so just remember these 4 genes which are involved. Okay, one is NPHS1, the second one is NPHS2, third one is alpha actinin 4, and fourth one is TRPC6. Okay, and which type of nephrotic syndrome they cause, and in that remember these 2. Okay, one Finnish type and the second one is idiopathic steroid resistant. Okay, now next is the most common type of nephrotic syndrome in different age groups. Most common variant of nephrotic syndrome in different age group. Okay, now first I'll be talking about the primary. Okay, because there are secondary causes as well. Okay, which are associated with certain medical conditions. Now, primary nephrotic syndrome in pediatric patients. In pediatric, it is minimal change disease. Minimal change disease. Okay. Second one is adult. In adult, it is focal segmental glomerulosclerosis, which is the most common variety. In elders, it is membranous nephropathy. Membranous nephropathy. Okay, now, what are the secondary cause? Secondary cause of nephrotic syndrome. Secondary cause most common is diabetes. Okay, so diabetes is overall also is the leading cause. Primary nephrotic syndrome is a rare. Okay, it's a rare condition, but secondary is secondary, which is associated with diabetes, is more common. Okay, so we have discussed all important questions uh, which are asked in different exams from this topic. Okay, I hope it is clear. Bye.